All right, my name is Morgan, and I'm going to be doing your assessment today. If anything is painful for you, just let me know, okay? And if you have any questions, you can also let me know. I'm going to start by doing hand hygiene and then giving us privacy. So I'm starting with the skin assessment. His color is appropriate. I see no rashes. His skin is very uniform. I'm now going to palpate for any lesions. The temperature is warm. I feel no lesions. The turgor is non-tenting. I'm now going to palpate his head and assess his skin, his hair. It is brown and there are no lesions and it is symmetrical. I'm now going to look at his nails. I see no clubbing. Capillary refill is 2 seconds. I'm now going to assess for facial symmetry, so his face is symmetrical. I'm going to test the trigeminal nerve, so I'm going to do this by having the patient bite down, and I'm going to feel him, those muscles tense up. Good. I can feel those muscles tense up. The trigeminal nerve is intact. I'm also going to have him close his eyes and tell me if it is soft or sharp when I touch his face.
Sharp.
Good. Yes, correct.
Soft.
Good. Correct.
Sharp.
Correct.
Soft.
Good. His trigeminal nerve is intact. I am now going to assess his facial nerve. So I'm going to have him smile, symmetrical, close your eyes really tight, symmetrical, and do pursed lips. Good. That is symmetrical. The facial nerve is intact. I am now going to palpate for his sinuses, so his temporal sinus. Do you have any pain with that?
No.
His maxillary sinuses. Any pain?
No.
And then his sphenoid sinuses. Any pain?
No.
Okay, good. I am now going to assess TMJ, so open your mouth and close it. Good. I feel no crepitus, or hear no crepitus, and I feel no popping or cracking. I'm now going to assess his neck veins. So the veins are appropriate. I see no pulsations. I am now going to auscultate and palpate the temporal artery. It is bounding in 2+, bilaterally. I'm now going to auscultate. I hear no bruits, no extra sounds. Good. I am now going to palpate his neck. So I'm palpating the trachea. It is movable. I feel no lesions. I'm now going to try and palpate the thyroid. It does not feel swollen. I'm now going to move on to palpating the lymph nodes. So I'm going to start with the pre-auricular, going to the post-auricular, the submandibular, the submental, the posterior cervical, anterior cervical. I'll have you turn your head. The deep cervical can sometimes be felt. If he turns his head, I cannot feel it on this patient. Turn the other way. Deep cervical, I cannot feel it on this patient. And then infraclavicular, or supraclavicular and infraclavicular. And then finally the occipital. All of these lymph nodes feel like little pea size. They're very movable, and they do not feel swollen. I am now going to move on to the eye examination. So I am just inspecting. His eyebrows and eyelashes are symmetrical. I am now going to palpate the orbital, view the conjunctiva, which is pink. The iris is green. His cornea is about 2 centimeters, and the iris is white. I am now going to test cranial nerve 2, which is the optic nerve, with this eye chart. So I'm just going to ask the patient to read, cover one eye and read whatever line he's able to read. I'll hold it out here.
L or G, F, D, H, J.
Perfect. And then cover the other eye and then read whatever line you can.
L, T, F, P, H.
Okay, good. So it looks like this patient has 20/25 vision in the one eye and then 20/20 vision in the other eye. I am then going to do the fields of vision test, which is having the patient cover one eye. And then I'm going to hold up a number, and I want you to tell me what I'm holding up.
2.
Good.
1.
Oh, and look at my nose. Good.
1.
Just keep your eye on my nose. Good.
5.
Good.
5.
Good. And then the other side, and keep your eye on my nose.
2. 1. 5.
Good.
5.
Good. He got all of these positions correct. I am now going to move to the corneal light reflex. So I'm going to use my pen light, and I'm just going to look into his eyes and make sure, look straight ahead at me. Good. And I see the right light reflex that is equal in both eyes. I am now going to do the 6 cardinal fields of gaze. So I'm just going to have you test ocular eye movement. So follow my pen light. Good, in all 6 positions. The patient had no problems with the 6 cardinal fields of gaze. Next, I am going to do 6 cardinal fields of gaze. The lid leg exam. So I'm going to have you follow my pen light up and follow it down. Good. I saw no lid leg. The patient's eyes followed, or the patient's lids followed his eyes down. I'm now going to do the direct light assessment. So I'm going to swatch his pupil, and the direct light in that eye, his pupil constricts, and the direct light in that eye, his pupil constricts. I'm now going to do the indirect light and see if the opposite pupil constricts. Good, and the opposite pupil constricted in that side. And the opposite pupil constricted in that side. Next, I'm going to do the accommodation. So I'm going to have the patient just watch my pen light. I'm going to watch his eyes. And his eyes are constricting when my pen light is moving towards him. So this is his eyes are accommodating. I'm also going to have you do the cover test. So I'm just going to have you hold this over your eye. I just want to see if there's any nystagmus. No nystagmus in this eye. Go to the other side. Good. And no nystagmus in that eye. Good. And now I will look into your eyes using my otoscope to see the optic disc. Oh, come on. Okay, it's not working right now, but I would put it on the smallest light setting, and then I would look in and view the optic disc. Very touchy. Okay. And in a normal patient, I would see a creamy white optic disc where the veins get smaller as they move peripherally. I'm now going to move on to ears. So I'm going to palpate his ears. Upon inspection, they are symmetrical, I see no lesions, no erythema. They look appropriate. I'm now going to look into his ears and view the tympanic membrane. And maybe I can get this to work. What the heck? I'm going to pull the pinna up and back to do this assessment. Viewing the tympanic membrane is a pearly white membrane. I see no drainage or erythema on that side. And the same on this side. I am now going to assess the acoustic nerve. So I'm going to do the whisper test. So I'm just going to whisper something into my patient's ear and see if he can hear it. 1, 2, 3.
1, 2, 3.
Good, that is correct.
1, 2, 3.
Good, that is correct. Now I'm going to be doing the Rhine test. So I will hit my tuning forks and ask the patient if position A or B is louder. A or B?
A.
Okay, he heard it louder when it's conducting through air rather than bone. A or B?
A.
Okay, he heard it louder when it was conducting through air rather than bone on both sides. And then we have the Weber test. So tell me if you hear it, if you feel it louder in one side or the other, or if it's symmetrical.
Symmetrical.
Symmetrical. Okay, the patient feels it symmetrically. And that is it for the ears. I'm now going to move on to the nose. So I'm going to start by just inspecting his nose. It is symmetrical. I see no lesions or anything wrong with it on the outside. I'm now going to use my pen light and look on the inside. I see no deviations. Everything looks appropriate on the inside. I'm going to palpate. I feel no masses, no lesions. Everything is symmetrical. I am now going to assess his mouth. So I'm going to have you open up. So his mucous membranes, let me see, under your tongue, under the tongue, top of the tongue, is all, you can close, it is all moist and pink. Now show me your teeth. Good, they're all intact. I'll look at your teeth. Good, they're all intact. I'm gonna assess your tonsils now. So tonsils are red. They are 2+, and I see no swelling or anything, no discharge. His gums are appropriate. They're pink and moist. I think that's it for those, and the teeth. And then we will do, we will test ocular nerve, or cranial nerve 12. So I'm going to have you stick out your tongue and move side to side. Good. And then we're going to assess the vagus nerve and the glossopharyngeal nerve. So I'm going to have you say, ah, and I'm going to look in.
Ah.
Okay, and I see the rise and fall of his soft palate. So this means that his vagus and glossopharyngeal nerve are intact. Oh, I also forgot to assess for the accessory muscle, but I will do that now. So I'm going to have you shrug your shoulders. Good, against resistance, and then turn head side to side. Good. His accessory muscle is intact. I think that's it.